Good afternoon, everyone. My name's Angus Clelland. I'm the CEO of Mental Health Victoria, and I'd like to welcome you to Learning from Adversity, Bushfires, COVID, and the Lessons for Mental Health Reform. This is the final webinar in our mental health webinar and symposium series for 2021. I'd like to begin today by acknowledging the traditional custodians of the lands on which we are meeting today and pay respects to elders past and present, and also to extend that respect to any Aboriginal and Torres Strait Islander people who may be here today. I also want to acknowledge the very great diversity of lived experience that will be within this virtual room here today. I'm pleased to introduce to you your MC for the event, Ingrid Ozols AM. It's not as if Ingrid needs any introduction, but for those who might not have met her before, Ingrid is the chair of Mental Health Victoria's Lived Experience Advisory Group and has over 20 years of experience working in the suicide prevention and mental health sector. She's also the founder of Mental Health at Work, which provides a full spectrum of mental health services for workplaces and communities in Australia. We're absolutely delighted to have Ingrid on board helping us today as MC. Before I go on and hand over to Ingrid, a quick plug for our annual general meeting, which is immediately after today's event. Professor Alan Furls will be providing a keynote address, which no doubt will be fascinating. So if you can come along, we'd be delighted to have you. So Ingrid, with that's it from me. Over to you.
Thank you, Gus, and welcome to our Learning from Adversity final webinar for Mental Health Victoria for 2021. Can you believe it that it's the end of 21? Probably a good thing given the year that it's been. So I'd like to actually make also an acknowledgement to our country and pay my respects to elders past, present and those emerging. And again, I'd also like to make a recognition of living and lived experience of those of us touched by mental health vulnerabilities, trauma and suicidality. I'd like to actually, before we start, do a big self-care message for everyone who's on this webinar, that this is going to be a challenging topic, even though we hope to bring out the hope messages. There could be some things that may cause some stress for those of you listening. So I'm really going to be urging us to create a safe environment so that we feel we can support ourselves and each other. There will be some resources that are going to pop up shortly for places for us to actually refer you to if you do need someone that you might want to reach out to. I do encourage getting up, go for a walk, pause, take a moment to get a glass of water. If you feel that you need to self-care, it's really, really important. The old oxygen mask analogy. So please take care. We're hoping to create an environment, we will create an environment where we do have an opportunity to interact, ask questions, as well as do a lot of wonderful listening of our amazing speakers. So what I would like to do is to give you a brief agenda overview of what we're going to be doing today. We've got a keynote address from Kris O'Brien, who is one of our National Emergency Medal recipients for his work in disaster relief and Australia during the Black Summer bushfire season. We've also got two panels of experts and leaders, both in bushfire recovery and in COVID-19, given what we're actually facing today. So we are going to be dealing with some challenging topics, and we hope that you'll leave the webinar with some understanding, given that we are coming into Christmas and what traditionally can be a difficult time of the year, and also compounded by what we've been experiencing with lockdowns and restrictions of COVID. And so that we want to leave us with some hopeful messages of how do we actually manage our self-care and caring and supporting others around us in our communities, so that we can actually make the opportunity to enjoy the life that we have around us at this given time and going on to the future in 2022. Now, before I commence, we've got a few housekeeping things. Our Mentimeter is going to be working for us during this particular webinar, which I'll explain to you shortly how to get onto that to help motivate interactivity. We've got social media presence, so please feel free to Twitter on adversity lessons with the hashtag at MHVic. So hopefully we'll be able to get social media interaction as well. Also, we would like to announce a prize winner for a $50 gift voucher that we'll be sending to our successful prize winner, who is Josie Caruso from WCCC. And we'll also be sending a $50 donation on behalf of Josie to a Disaster Relief Australia charity. So thank you, Josie, and congratulations. We'll be sending you that information via email shortly. Just a couple of other things. Please remember to put your button on mute and also to turn off the video. We will be running the Q&A via the chat forum as well as through Mentimeter. So please interact. We would love you to participate as much as you can. We will be having questions throughout the panels, and then we will also be inviting people to actually put the questions in onto the Q&A, and we will try and then ask our panelists to respond at the end or at the another stage, and we'll get them back to you so that we're able to cover all the bases in case there are some things that arise during the webinar that we don't actually get to address. So today is around acknowledging the challenges that we're faced when we experience disasters. And we are in a country of where we do experience these. And so this is the time of year where we want to acknowledge traumas that are occurring probably constantly for many of us in different guises of life that we find ourselves in. We've had traumas leading up to COVID. We've had the bushfires that have been occurring both in Victoria and in New South Wales. So we actually want to focus in on the impacts that they've had and how we can actually use the lessons through those experiences so that we can help heal, to help bring around validation of trauma so that we can actually as a community help support each other, not only in a reactive there and then moment of crisis, but also in the short term and the long term. Because often, as happens, we become reactive in one situation, and it's very easy then to when the media or the limelight passes and we go on to the next challenge that we face, that there's a tendency to look like we forget. And that's when our community members need their most support, because we don't want to forget. They can't forget because they're living, or we're living in those situations every day whilst we're healing. So I'd actually like to start with Kris O'Brien, who's going to be our keynote speaker. Kris is a statewide coordinator of Mental Health Victoria's Lived Experience Peer Cadet program. And as I've mentioned, he's actually a recipient of a National Emergency Medal for his work in Disaster Relief Australia and his work with the Black Summer bushfire season. He's previously worked with Open Arms veterans and family counselling as community and peer advisor. I'd actually like to invite Kris to the podium, to the Zoom stage, and ask Kris to share his insights into learning from adversity. Feel free to write any questions on the Q&A, and we will then have Kris staying on during the webinar to take those questions in the background as we continue with this final opportunity to connect in 2021. Thank you, Kris.
Thank you for that wonderful introduction, Ingrid, and for being an amazing source of inspiration, information, and support for all of us. Before I begin, I would like to acknowledge that the location in which I'm presenting is on the traditional lands of the Wathaurong people of the Clelland Nation, and pay my respect to elders, both past, present, and future. I'd also like to acknowledge the individual and collective expertise of those with a lived or living experience of mental health, alcohol, and other drug issues, and of disaster recovery. I recognise their vital contribution at all levels and value the courage of those who share this unique perspective for the purpose of learning and growing together to achieve better outcomes for all. I'd also like to thank and acknowledge all those in attendance for their time today, and for Mental Health Victoria for hosting and facilitating this event and the opportunity to share information on this important area. Welcome to a crash course in the disaster space and its terminology. Many of the images in the presentation today were taken by myself at various stages in supporting bushfire recovery, and the images of Tathra were provided by a community member. Over the course of this presentation, we will touch on some key areas, many of which will be discussed in the following panels, including disaster resilience, supporting disaster recovery and resilience, global managerialism, and what can we take from our knowledge of disasters moving forward and apply to post-pandemic recovery. What is disaster resilience? According to the Governance and Social Development Resource Centre, disaster resilience is the ability of individuals, communities, organisations, and states to adapt to and recover from hazards, shocks, or stresses without compromising long-term prospects for development. When the term disaster resilience is used as a collective, such as discussions in forums like this, it can be used in a way that is focused on individuals or communities. Community disaster resilience is not specifically focused on the individual within the community, but focused on the community as an entity and its ability to respond and recover from disasters. Individuals within communities may display high levels of resilience after a disaster, yet from a resilience and recovery perspective, a community as an entity may still be severely affected. The images shown present some recovery and rehabilitation efforts conducted by the Tathra community post the bushfire in 2018. If we imagine being an individual who has suffered a bushfire, but began recovery, having the view on the left every day in opposition to the view on the right, it can make a large impact to a view of recovery after a bushfire and be an ominous presence in the feeling of rehabilitation efforts. Projects like this can show community resilience and recovery while displaying hope through rebuilding. How can we support community disaster resilience? As a point of understanding, there are different stages in the recovery from disasters. They can be briefly summarised as relief operations, typically around 45 days. This involves initial emergency response, distribution of aid to meet basic needs such as food, water, shelter, and the provision of access to available immediate services. Recovery, typically around 3 years. This involves restoration of community infrastructure such as schools, community centres, and housing, and the provision of ongoing support services. Rehabilitation, typically 5 years or more. This involves helping communities return to pre-disaster conditions, supporting long-term development of the community, such as healthcare facilities. There are many areas that can be supported to help a community and individuals' abilities to respond and recover as displayed on the slide, and I'll briefly touch on 3. Education, awareness of risks, ways to respond, awareness to resources that are readily available within the community, the development of skills within a community to support the capacity to respond, preparation, having a plan for the event of a disaster and the recovery prior to a disaster occurring, communication ability when an infrastructure is damaged, points of information distribution defined, and collaboration between services and their roles planned in advance. As a modern society, we are heavily reliant on our phones. This area addresses communication efforts when this may not be available. For services engaging with communities, it is important to hold to the awareness that, much like the approach in supporting individuals within the mental health sector, acknowledging that a community, like every single person, is individual and unique is vital. Fundamental challenges already present in communities will be in most cases exacerbated after a disaster. Global managerialism. Simplistically, a global managerial approach towards climate-related and environmental disasters supports the view and expectation that all communities and individuals who are affected by disasters have the same capability to respond. The view that all affected by disasters have the ability to respond equally discounts many areas of importance, such as geographic location, technology, funding, education, and infrastructure. An example of this could be the expectation that a rural community that is limited in the services and supports that can be accessed is able to recover in the same way as a metro or regional community where there may be an abundance of relevant support and services readily available. What can we take from our knowledge of disasters and apply to post-pandemic recovery? One of the resounding things that I've seen, heard, and learnt from my experiences working with disaster-affected communities is the ability for communities to band together and approach recovery. Interestingly, in numerous studies conducted, it has been shown that communities that have experienced disasters, inpatient mental health admissions often drop for a period of around 3 months. Why might that be? If we look at the model of lived experience and its support of those experiencing mental health needs, we see that having someone with a similar or shared experience can make an immense impact. In a disaster-affected community, individuals are experiencing this as a collective and coming together to rally and given a united purpose, leading to some of the isolating factors that may have previously been present being removed. As we see things like recovery centres closing, individual recovery occurring at different stages, and factors influencing community engagement occur, feelings of isolation can return. So too do the mental health admission rates. Having something to work towards can be a protective factor. In the case of disasters, rebuilding and returning to normality. During the pandemic, through the lockdowns, we were working towards returning to normality. Our livelihoods, relationships, and day-to-day function was affected, but we were all doing our part. As we've seen through the approach to disasters, recovery takes time. There is no linear time frame in which we can say everything is back to normal. Periods of isolation can have many effects. Bringing back community and connection can take time, but we have an ability to support this and lead the way moving forward. Some positive steps have already been taken in proposing a recovery period post-pandemic and the creation of community mental health drop-in centres. I've spoken to many individuals at different stages in disaster recovery, and one of the most amazing things that has been communicated is that the periods of close community connection and purposeful work towards a goal is missed by many. Communities that continue this connection increase their capacity for resilience and recovery in the future. I'd like to share some words that I believe show the value we as individuals can have in supporting disaster relief, resilience, and recovery. Engaging in disaster relief and recovery gives us the opportunity to bring humanity back into a situation that is inherently lacking it. Disasters and the pandemic don't discriminate. It can affect each and every one of us, regardless of how prepared we are, and it can feel inhumane. Inquiring about others and how they are feeling, saying hello to someone on the street, or just plain and simply being there without an agenda can have an immeasurable effect. In our engagement with individuals and communities, we are able to bring hope and a way forward, whether it be starting with the simple question of how can I help? If I've piqued your interest in the disaster space and you'd like to learn more or get involved, here are a few ways. Much of my work in the disaster space was engaged as a volunteer with Disaster Relief Australia, who in my experience are a great example of bringing hope and support into disaster-affected communities. Disaster Relief Australia provides disaster response to those affected by natural disasters, be they domestic or international, by pairing the skills and experience of military veterans with emergency first responders, medical professionals, and technology solutions. Disaster Relief Australia aims to provide the greatest service and impact possible. I'd also like to raise awareness to their current operation here in Victoria, Operation Thorpe in Mallacoota. Disaster Relief Australia are currently conducting a short-term response to Mallacoota and surrounds to assist in ongoing bushfire response and recovery efforts after the 1920 bushfires. The purpose of the operation is to help make locations safe and clean up community and residential properties for future reinstatement. A new initiative that has been created, the Australian Resilience Corps. Australian Resilience Corps is determined to reduce the devastation caused by fire and flood across Australia by 2025. They do this by working with and through a coalition of existing volunteer partners in the disaster space. They aim to create a culture focused on building resilience by bringing together corporates, volunteer partners, and community members. Thank you for your time today. I hope that you've taken something of value from this presentation. I'm extremely grateful for my experiences working in the disaster space and constantly being inspired by communities and individuals throughout the field. Please remember to be kind to yourselves and others during the post-pandemic period. We're all in this together. To finish, I'd like to share some words by Rebecca Solnit, an award-winning author who spent time working with many communities in the wake of disasters. The steps to recovery start with us. People rescue each other. They build shelters and community, kitchens and ways to deal with loss and eventually rebuild one way or another. I will be present in the chat following this presentation and throughout the seminar to answer any questions that you might have. Thank you.
Kris, thank you for the presentation and the work that you've been doing in this space. It's people like yourself that are an absolute role model and inspiration to those of us who at times feel helpless when a particular crisis can happen. And so we thank you and all of your colleagues and community members who come in to help, both at the time of crisis, but very much once those crises become more long-term and acute situations and chronic situations that we as a community need to face and help bring together. And that's what I really loved about your message of connectedness. That connectedness is something we can't underhear. We need to constantly keep hammering it because it is so important, and we can't underestimate the power of reaching out to one another. Before I introduce the panel, there was one other message that I did want to say thank you to you for highlighting, Kris, around the notion of taking resilience to another level, to actually talking about what resilience means in the community. There are often, these are words that are thrown around a great deal, but what does it actually mean? By looking at the global managerialism and unpeeling the onion, we're able to better understand and hopefully feel a bit more comfortable in constantly trying to reach out to one another. And that goes back to the connection, that we can't connect with each other too much. Thank you for that. I'd like to now bring on our first panel, the Bushfire Recovery and Mental Health, a panel looking at obviously bushfire recovery and talking about its impact to mental health for both first responders and the community. So I'd like to introduce our guest speakers. We have Carmel Flynn, the CEO of Bushfire Recovery Victoria. We have Dr. Rob Gordon, clinical psychologist and expert in post-disaster mental health. We have Anastasia Bougesis, Chief Development Officer of Disaster Relief Australia, and Kylie Williams, Head of Practice and Impact and Management, Save the Children. Welcome to all of you, and thank you so much for participating in our last event for 2021. And given that we are about to start December tomorrow with the strange weather, it's that time of year where we do talk about these things and need to talk about it, but also try to acknowledge that there is a long-term impact, not just at the time of year. And so I'd like to thank you all for being participants in this last webinar. What I'd like to do first, before we start, is to remind the audience that we would really welcome your participation in this. We've got Mentimeter that's actually set up. If you could go to your devices and go into www.menti.com and actually register with the number 980 17 12 3. That's 980 17 123. And please pop up your Q&A questions for our recovery panel, which I'll be trying to draw upon towards the end of our 35-minute session with some very knowledgeable and passionate people who are coming together from different elements of the sector to bring us knowledge that perhaps we can use in our day-to-day interactions with people that may be experiencing challenges from disasters. Okay, what I might do is I might ask each particular panel member to actually give us a brief what brought us here today, or what brought you here today. And I'd like to start with you, Carmel.
Thanks, Ingrid. Can you hear me okay?
Yes, we can.
Great, thank you. Well, you mentioned being passionate about what we do, and I'm very passionate about disaster recovery and particularly around mental health, and not just for understanding trauma and its impact on communities affected by disasters, but also the importance of understanding and supporting recovery workforces. I've had a lifetime of experience in disaster and crisis situations. I was in the military in the 1990s, so undertook peacekeeping, peacemaking operations, seeing the impact of and felt the impact of active service. By having faced those situations, I was privileged to work in humanitarian work internationally with Australian Red Cross in the 2000s, and in the last 10 years have worked in state government at the former DHHS and education, and now am the acting CEO of Bushfire Recovery Victoria. So I understand the criticality of this topic for communities and for workforces involved in disaster recovery. So thanks for having me.
Thank you, Carmel. I might ask Rob.
Oh, thanks, Ingrid. Hello, everybody. I just think it's so important to pass on some of the experience that I've gained in 40 years of working with communities all over Australia and New Zealand with all sorts of different disasters. And unfortunately, the best way of learning is through bitter experience, through seeing what goes wrong and learning that we don't do that next time. So I've worked as a clinical psychologist with people who've experienced all sorts of events. And so I've seen the effects on their lives up close. But I'm really interested in how communities can do the bulk of the work of helping each other through. And that's one of the things I'd like to pass on today.
Thank you, Rob. Anastasia.
My name's Anastasia. I started my career early as a mental health nurse and a paramedic, and I've since moved into working for Disaster Relief Australia. So we really support communities through their recovery journey. We are a not-for-profit, we're veteran-led, and we deploy ex-military personnel into disaster recovery so that they can continue their service. We have a very strong focus on community and community-led recovery and responding to the needs of each and every community.
Thank you. Kylie.
Hi everyone, my name's Kylie. I hope you can see me okay on screen, Ingrid. I've been a social worker for over 25 years, working with children and young people and families and communities, right through from early intervention to the tertiary and clinical end of the service support system. And I've seen the impacts of disasters firsthand. I was previously involved in the Child and Youth Mental Health Recovery team after the 2011 floods, so in response to that. And I'm currently the head of practice and impact measurement at Save the Children, and Save the Children have been extensively involved in supporting children, young people, families, communities, following the natural disasters that we saw with the bushfires in recent times and with COVID as well. And I'm really passionate about listening to children and young people and making sure that their voices are heard and making sure that we're responding to their needs in ways that help and make sense to them as well.
Thank you, Kylie, and thank you to all of you for sharing your backgrounds and your amazing experience, from which I'm actually hoping to draw upon in the next little while, so that we can have a discussion around what we can all do to make a difference in situations that do create a lot of trauma, and how we go about validating the trauma, but also then how do we help support healing. Now, disasters affect us all in different ways. So there's no one particular population that is more or less impacted. Trauma is trauma, and there's no competition of pain. So what I'm hoping out of this session, that we're actually looking at obviously the whole population, but we're going to try and drill down into certain areas, particularly focusing on your areas of interest: children, young adults, how we can actually then help parents, community, and then of course the impact of disasters on our first responders, our emergency services. So that's sort of my own guide of what I'd like us to do with this particular panel, so that we can address those perspectives of how we can move forward in recovery and in healing. So I'd actually like to ask Kylie the first question. Given your experience, how can we better help children to respond to natural disasters?
I think there's lots we can do in this space, and Kris made some really important points, I think, that relate to children and young people as well, in terms of the importance of knowing what supports are available, children being involved in disaster planning before an event, so that they know what to do when things happen, and they feel like they have control over next steps. Bringing children together to share their experiences and involving them in rebuilding and returning to life post-disaster as well. And I think in any crisis, children are particularly vulnerable. We know that, and we know that natural disasters can really impact how they feel about their physical safety and their emotional well-being. And it's really challenging for adults around children during that time as well, because we know that trauma is overwhelming, and it's important for adults to understand how they're going themselves, look after themselves, so that then they can provide support for children, and understanding that children's responses often show up through their behaviour as well during this time. What we did learn at Save the Children during the Victorian bushfires that was really highlighted for us was the critical need for universal and really accessible psychosocial support after a disaster for children and young people, and the delivery of that through trained staff alongside the community in spaces where children and families naturally attend. So going to those spaces so that safe spaces are created for children, both physically and emotionally, so that they can start to open up and be vulnerable and talk about their experiences of natural disasters. And we know that these kinds of safe spaces, when they lose their homes and bushland around them are really impacted, schools are one of those spaces that are trusted by children. And through our research and consultation, this is what children and young people consistently told us, that they wanted us to come and provide the support following crisis in these spaces. Children and young people also told us coming together was really important to them. So coming together with their peers, with their friends, talking about their experiences really helped to normalise what they were going through, and that they weren't alone, and to be able to process what had happened and start to develop some coping strategies together as well. And I think that oxygen mask analogy, Ingrid, that you made earlier is probably a key takeaway. Often we put everybody else first, but it's really important that we're looking after ourselves so we can take care of children and young people as well.
Absolutely. Thank you, Kylie. Rob, I'm actually going to ask you the similar question, but going the extra age group, as in young adults. And you made that comment about the bitter lessons of having to go through these experiences to learn stuff. And it is a painful process, obviously, but we don't know what we don't know until we experience it. So from this, how can we help our young people and then therefore parents and community?
I think it's really important to remember that young people are very capable, because they often have the mental capacity of a mature adult. What they lack, though, is the experience. Therefore, very often young adults will look around, they will see what's happening, they will put it together in their mind. But what they won't have seen is how people actually come through the other end of long, difficult times. And it's been well shown that one of the effects of very traumatic events on teenagers and young adults is a sort of, the risk is a sense of pessimism coming about, where all of the suffering and the difficulties, and they haven't been through the other end yet. So we've got to guard against them becoming pessimistic and having feelings of hopelessness. What's the point? We've seen intimations of that in the schools affected by bushfires. Some of the kids are saying now, what's the point of learning all this stuff? So I think this is really where what Kylie was saying about talking is so important, to draw these young adults together. And what I know from working with young adults is that in many ways they are very vulnerable to isolation, because they've no longer got the preset networks of school, and tertiary education networks are much looser, and you can be very lonely at university or TAFE. And adults, if they don't recognise this, may have left the young adults to their own devices, assuming that they've got the maturity to deal with it. And they do have capacity to deal with it, but they need guidance. They need this perspective that the adults can give, and a sense of optimism and history that we've survived many things. So therefore, I think one of the most important things for parents to do is to actually get close to their young adults. Don't mollycoddle them. Don't think that they're weak and vulnerable. They're very courageous and very capable, but they actually need a chance to talk through and understand what they're struggling with and get this perspective of how we're going to get through this. So they're a group that is sometimes their needs are not recognised.
Thank you, Rob. It is having those uncomfortable conversations with courage and with assertiveness, but it's these sorts of forums that help all of us as community members in the different roles that we play as parents, as school teachers, as first responders, to confirm and give us permission that it's actually okay, that it's okay to be vulnerable with our children, and to actually believe that they are more able to cope with things than perhaps we thought. And so these are really important messages, and I thank you for your expertise and for sharing those, Rob. I'm actually going to go back and ask Anastasia for your perspectives around how we can actually help through your experience with first responders and community.
Thanks, Ingrid. I think there's a really important thing that needs to be spoken about around first responders, and that is that it is in our nature to serve. It's in our nature to serve the community, and it's in our title as first responders to respond to events. So I think for first responders during that period and that response period, that's likely when they're at their best. They have the tools, they have the equipment, they have the training, and they have the mindset to be helping in whatever capacity that is with that event. And the critical time really comes after that, when the lights and sirens have died down, and the recovery phase and that rebuilding phase is when those first responders sort of get the chance to take a breath. They might feel a little bit less useful during that phase because they've completed their response activities or their whatever it is that they might be doing in that phase, and then it's about what else is happening and how that they can really integrate with that. I think probably the best thing as a family, a friend, a peer of a first responder is to have your plan ready so that they can focus on the job that they need to do, so that they can go out and respond to the community in that space, and know that you are safe and well and doing all of the right things. So early preparation for these events is something that's important for everyone. But as far as supporting that group, that's something that's really critical. Once, as I've said, once that event is over, that's when things, might start to come up, or the decrease in activity will then have an effect on this group. So they do have a tendency to put others' needs before themselves. So once those needs are taken care of, then it's really time. This is when peer networks become critical. So peer networks within first responder communities are a critical enabler to wellness and to coping mechanisms. And just remembering that we serve the community. That's part of the DNA of first responders. So that's always going to be their priority.
Thank you, Anastasia. And it's also about community giving back to our emergency services, so that there is that double support, that we're all in it together. Carmel, I'm actually hoping to ask for your perspective on what your learnings have actually helped you to help communicate to our community members about how they can recover from something that has been so traumatizing.
Yeah, thanks, Ingrid. And look, there still is a lot to learn, but just reflecting on the words of Rob and Kylie in particular, one of the key things that we found is to make sure that there are ways for all parts of community, including children and young people, to be fully engaged in recovery, to have a voice, to have agency. For if government is leading recovery, in inverted commas, with recovery agencies, then we may have a legislative responsibility for that. But if we're going to get good outcomes for community members, then we actually have to sort of take this back seat and have very authentic, empowering relationships with all aspects of community. And if I could just use, just by way of example, because we've just been talking about children and young people, one of the things that we did as an organisation very early on in the bushfire recovery is we established a partnership with an organisation called YACVIC, which is the Youth Advisory Council of Victoria. And with the Department of Education, we set up a very close partnership whereby our staff members met with them every week. And the whole aim of the partnership was to empower young people to lead their own recovery. So, there was ongoing dialogue, ongoing consultations, making sure that we did authentically listen to what the YACVIC, their members, were telling us what was being experienced by young people through the phases of recovery. And we used that information to really inform the work that we did. One of the outcomes that we actually produced, that the initiative produced, was a report called A Seat at the Table, and you'll be able to find it on our website or YACVIC's website. And it's a report that essentially sets out, with YACVIC's guidance, how to better engage with young people, particularly in disaster recovery. And it's a guide that it does target community members, leaders, and those working in recovery, to make sure that we are inclusive of youth participation in recovery programs. And then just similarly, that's one sector of society and community, and I would extend that thinking that successful recovery involves empowering all parts of the community, and making sure that where they wish to have a voice and where they wish to participate and have agency, that we're giving them that opportunity.
Thank you, Carmen. The importance of self-agency and empowering our young people seems to be such a strong message through all of your experiences. And given that they are the future, and as well as an opportunity to connect each other with community members, and children do that for all of us in their different environments that we are with them, from school and sporting and community activities, we're often actually brought together by our kids. So what I'd actually like to do is, Rob, to go back to yourself and ask you around the importance of community education, because that's the other message that keeps coming through in what you've been sharing today, is we're dealing with trauma, we're dealing with despair that we can't imagine. And so how do we actually talk through, or how do we actually help people to manage the pain so they can then talk about coping and then managing coping?
It's very interesting. I like to say there are three main problems. One is the trauma, which is the bad experience on the day. That usually involves some kind of threat. The second one is loss. And even if there aren't lost lives, there'll be lost property, there'll be lost environment, there'll be lost friendship networks, there'll be all sorts of tangible and intangible losses. And, we base the security of our life on the familiar presence of things that we're used to. But the third one is very important. It's the stress of living a disrupted lifestyle for a long time. And it takes years to recover. Now, if we go to the trauma first, it's most important that people understand the fundamentals of trauma. The word means injury or wound. So the medical care of traumatized people is people who've been run over by buses rather than had a heart attack. So it's an external impact, and the fire, the flood, whatever it might be, impacts on us. Now, what we know is that there are various sorts of traumas. I make a distinction between the actual trauma, if I'm there and I have to save myself from the fire and it's terrible, or the anticipatory trauma. It doesn't need to happen for me to be traumatized. If I think, my God, this fire is going to come over the hill, I'm going to die, I've faced death for the first time in my life, perhaps. I'm permanently changed. So we need to understand that there'll be a lot of people who, on the face of it, don't seem to be that closely involved, but whose lives are changed by the impact. And we also know from the research from Melbourne University that those people who had any degree of separation from their loved ones during Black Saturday, at the time of the fire, were much more at risk for poorer mental health, even 5 years down the track. And that's where I call that the informational trauma. That is, it's not the fire, it's that I don't know where my loved ones is for a long time. And so there are these different layers of trauma. Now, what we know is that the effect of trauma is to shatter an assumption that I haven't questioned before, that life is safe, that my loved ones are always around, that nature is kind and beautiful, and so on. And so really the question is, how do you reconstruct your idea of the world that doesn't lose the kindness and beauty of nature, but also says on certain conditions that are very predictable, it'll be very fierce and very dangerous. And so we must be prepared. In the same way, I like to say that we're prepared for snakes if you live in the country. You know they're there, and we live with them. You talk to New Zealanders and they don't even want to set foot in the country because of the snakes, but we live with them. And we can live with fires and floods and so on, but we need to learn about them. We need to learn about our minds. And what's so important is to actually tell the story. I noticed someone's put a question in here in the Menti out of the corner of my eye, that young people don't want to talk about it. They say they're okay. Don't talk about their feelings. Don't talk to traumatized people about how they feel. Talk to them about what happened. That's what they want to talk about usually. And very often they don't have it clear. They don't have it complete. And putting the narrative there is what is the basis for the healing and the resolution. They don't know what they feel until they put that narrative together. And that then leads into the support for the loss, which is, grieving processes. We've got to make people clear that there'll be lots of things to grieve. We know that bushfire affected people often only grieve what they've lost when they've moved into their new house and fully settled in. Then they start to think of all the things that were part of their life that are no longer there. You don't have time to do that when you're trying to build a house and find accommodation and deal with all the problems. And the third one I want to speak about, which is so important for people to understand, is that extended period of stress. Now, stress puts us in this state of heightened arousal in order to deal with it. That's why it's adaptive. But as a result of that, we get a narrowed focus on the most specific, immediate, concrete problems. And if we're not very careful, we ignore ourselves, we don't take care of ourselves, and we ignore everything else around us. And so you might get through and build your house and do a lot of heroic work. And this is also a problem for emergency service people and volunteers and recovery workers. Throw ourselves into it, neglect everything else. You come out the other side and your relationship's not working too well. You're not too close with your kids, or your friends have drifted away, you know, and I call that degraded quality of life. It's not a mental health problem, but it leads to mental health problems. So it's having that awareness to say, stop, I must hang on to everything that's important. I must spend time with my loved ones. I should socialise. I should rest. I should engage in recreation, and let's do the recovery in a steady pace. And the adrenaline will tend to push everyone into trying to get it done tomorrow, and they can't. So then they convert the adrenaline into rage and frustration.
Thank you, Rob. There seems so much to unpack in your response, and I wish I could say that we've got the time to do that, but I'm really cognizant of it. But what I do see is that circular constant around communication, around education, that one influences the other. If we can communicate better, then we can connect better and our relationships improve. So it's really around us finding one thing each, if we can, during this webinar, moving forward, is something that you feel you can hang on, but with that guise of underneath self-care being really important. Having the conversation with your inner self around, well, how am I going to look after myself so that I don't burn out, so that I'm not putting myself, well, if I am in the risk of vicarious trauma, that I'm actually able to self-care. What I'd like to actually ask now of Anastasia, how can we use our learnings? And Rob gave us some really powerful definitions and a deeper understanding of the levels of trauma and when these sort of things occur. And there is no prescription as to how and when we can turn the tap on and feel and experience the different phases. But what has worked in your experience, and what have been the strengths that have come out from responding to these disasters?
Yeah, I think the biggest thing that I see time and time again is the strength of the community and the community coming together. So that's either individuals within a community or the community as a whole. I can speak from lived experience. I was affected by the Cudley Creek bushfires in Adelaide Hills in 2019. And what I saw there was before a government response was, a state-based response was stood up, there was a young leader in the community who stood up and sort of led the recovery or the relief until the agencies were able to enter the area and to get in. So definitely those leaders within the community and all the community coming together, you know, better together, stronger together, it really rings home during these times. And it's such, we know that community-led recovery is important, but we do have to recognise that that's different for every community, that's different for every individual. Every individual's journey is going to be very, very different depending on their perspective, their experience, their past, their social networks, a bunch of demographics and statuses that will affect that journey for them. But the coming together of the community is a constant that I see throughout disaster recovery spaces the world over.
Thank you. Now, I'm aware of the time, so I might just quickly ask Kylie and Carmel for a gem of wisdom from your own experiences of what's worked that we can take forward for our participants listening. Carmel.
I'll be first. Okay, thank you. Look, I think being as educated as what we can be is really helpful, like upskilling our recovery workforces. And, you know, Rob has played an incredibly beneficial role for us at Bushfire Recovery Victoria to inform us about the sorts of things that communities might be going through at this time, you know, 2 years in after the bushfires, but also informing us about how we as recovery workforce members may also be being impacted. I think the other key takeaway for me is this notion of the pace of recovery, that it's not the same for individuals. Anastasia just talked to that as not the same for different communities, and government's very bad at recognising, to actually slow down and go at the pace of those affected, as opposed to going at the pace that dollars might be available for grant programs, etc. But that's a really key point from my perspective, to really consider the pace of those affected, and to allow community members to recover at their own pace. And just along with that, what we call the Bushfire Recovery Case Support Program, where we engage agencies to provide a manager for a household impacted by, in this case, bushfires, but it's also the same after major emergencies, is an incredibly useful service, because it allows people to tell their own stories and what's impacting them, and to receive more individualized support. So the agencies who we engage and partner with to provide that service really provide a massive difference right from the very outset of a recovery program, all the way through, and that helps tailor appropriately. Thank you.
Thank you, Carmel. Now, I've realised we're really close to the edge, so I'm going to ask Kylie, rather than actually being able to go to some of the questions that we've had on the Mentimeter, which are really great questions, but unfortunately require really deep answers, that we might actually offer those answers after the session and come back to the audience later with those responses. But Kylie, as a final speaker for this panel, what's a take-home message for you that you'd like to leave our audience with?
Well, there's lots of take-home messages, Ingrid, but I guess what we learnt through delivering our Journey of Hope program, and also our Voice program in schools and in local communities, was that children expressed to us that they were frustrated that their capacity to help with responding and rebuilding and preparing for future disasters wasn't tapped into. So I think there's a great opportunity there that we can improve the quality and effectiveness of our emergency planning by empowering children. And our Voice, the program through Save the Children, works with local councils and young people in those communities to bring them together and listen to each other to develop that emergency planning moving forward. And we know that those things have really positive benefits and impacts for children and young people, and help them on their recovery journey.
Thank you, Kylie. Thank you to all of you. I think this has been a really important conversation and brings to light the importance of actually going to the people who've experienced these things firsthand and inviting them to the table to be part of recovery and solution building, and solutions that are actually benefit the person who's gone through this and who may go through these unfortunate situations in the future. It's that being prepared that seems to be the key, underlining what it is that we've been talking about today. So I'd like to say thank you to each and every one of you. I could have spoken to you for much, much longer, but I thank you for your time, and feel free to please lean in and help support each other. And thank you so much for your work and your efforts. It's been great to have you. We might now start with the next panel. And I'll just give us all a moment to have a breath and maybe a quick gulp of water. And I'm talking to all of us who are coming in on Zoom, because we're going to start, unfortunately, without too much of a break, but you can step up in front of your computers. We're not going to see you because you've got the videos off. So I'd like to actually take the time now to welcome our second panel group. And we're going to be talking about, obviously, COVID-19 and mental health and its impact. So I'd like now to welcome to this panel discussion Belinda Caldwell, the CEO of Eating Disorders Victoria; Belinda McGregor, adolescent mental health nurse, Southeastern Health; Dr. Dave Carmody, child and adolescent psychiatrist, Call to Mind; and Dure de Winter, programs manager, youth leadership, Centre for Multicultural Youth. Thank you so much to all of you for joining us in this afternoon's panel. Again, we're going to spend the next 30 minutes or so having a bit of a conversation around your backgrounds and your learnings through what's been a really challenging time, to say the least. I'd like to invite the audience members to again participate in the Mentimeter, and please put up your questions and answers. And this time we'll try and bring us back to having more minimalist responses in what's a really tough subject, and we could talk about it for hours. So I know I have to be a bit more of a tighter chair here, but we'll try and leave a bit more time for some final questions from the group, from the audience members as well. So I'd like to actually ask each of you to give us a bit of background as to what brings you here today. And so I actually might start with you, Belinda Caldwell.
Thank you very much, and thank you very much for having me here today. I'm the CEO of the Peak organisation supporting people impacted by eating disorders and their families and supports. I come to that role from quite a career in sort of health change management, public health, and some not-for-profit management. And I also have my own lived experience of caring for my gorgeous daughter, Lucy, who developed anorexia as a teenager. And is currently doing very well. So that's kind of what brought me to the role, and I guess to this panel really is, eating disorders. We've seen a really dramatic increase in eating disorders over COVID, and in lots of new cases, relapses, and a real spike in acuity and complexity in eating disorders.
Belinda, can I just take the opportunity then to ask you a little bit more about why you think that's been the case?
Sorry, say that again.
Could I just ask you around why do you think the eating disorders has been like a noticeable spike during this time?
We're not really sure. We've seen, the literature shows that we've actually seen that worldwide, and we've seen it in jurisdictions that had massive lockdowns and jurisdictions that didn't. And so there's something more about COVID. Eating disorders often come from a place where people are very, the anxiety is kind of a significant mental health component driving eating disorders, and sort of that ability to tolerate uncertainty is a bit tricky. So, so we think that just that whole uncertainty element has been incredibly triggering, both for people with existing eating disorders who might have been doing okay and they've flipped back into the eating disorder, but a rise in young people developing eating disorders, and the removal of the structure that school provided and all of the sort of typical activities that they were engaging with before, having those unsettled or not knowing whether things were going ahead. I think it's my, I guess it's my informed position that it's got something really strongly related to do with uncertainty and the high levels of uncertainty.
And I would like to ask, are we talking about, what sort of eating disorders are we talking about?
All eating disorders. So we've seen an increase in all eating disorders, so, restrictive eating disorders like anorexia nervosa, but also the eating disorders with the more common eating disorders with the binge component, so bulimia nervosa and binge eating disorder. We've actually seen a bit of a spike. We don't have data on it, but certainly on our helpline around ARFID, which is the avoidant restrictive food and intake disorder, which is another subset of eating disorders. But in young people, we've seen an increase in that as well.
Thank you, Belinda. I'd like to now ask Belinda McGregor from the Adolescent Mental Health, Southeastern Health. Belinda, what brings you here today?
Just unmuting myself. So I'm a mental health nurse at the adolescent unit. So I'm sort of in an interesting position because I actually completed my graduate year last year. So I just graduated from university in 2019, and then I did a graduate year in 2020 when the pandemic started. And in that year, I worked in adult mental health, and I worked in elderly mental health, and now I'm in adolescent mental health. So I've sort of had quite a big, big range of like how the mental health has affected all of everyone, I guess, across all age ranges. But yes, I've just spent the last year working in adolescent mental health. And I've seen very much like how this has affected children. And I do agree with Belinda Caldwell. Very much, the eating disorder is it's very increased.
Belinda, can I just ask you from your perspective then, what do you think about that spike?
In eating disorders?
Yeah.
I agree with Belinda. I think it's the stress of the lockdowns with eating disorders. There's a lot of this idea of wanting, that's one thing that they can control in their lives. They don't really have it control, especially with the lockdowns. They don't really have control over what's happening with them. They can't even go to school. So that's my perspective. That's one thing that they can control is that what they're eating.
Thank you, Belinda. Dave, what brings you here today, and what are your thoughts around what you're seeing is presenting with our young people?
Yeah, thanks, Ingrid. My name is Dave Carmody. I'm a child and adolescent psychiatrist. I work in private through my telehealth practice, Call to Mind. So seeing young people, mostly in rural areas, but also increasingly during the COVID pandemic in metropolitan areas as well. And I also work at the Victorian Aboriginal Health Service. I suppose my experience during this time as a clinician has been, I see mostly teenagers and adolescents through my private practice. I've seen a lot of difficulties around the stopping and starting school, and sort of the people who may have had some challenges around school avoidance or school refusal. I've seen a big increase in numbers around that, this from my own anecdotal experience, and just the challenges of reintegrating back into school after a school term has been interrupted by at-home learning and stuff like that. I think I've seen a lot of families where they may have, where the structures at home are less robust, and that makes things like schooling from home very challenging, I think, particularly if there's stress on parents and on the young people. And I suppose for our practice as a whole, the telehealth practice, it's about 30 psychiatrists working through it. We've seen a steady increase in referrals from metropolitan areas as well. I think a lot of those do reflect some stresses of the COVID pandemic, but we've also seen probably a greater uptake of telehealth and willingness to use that as a modality during that time.
Dave, I was actually going to ask you, what are some of the innovations that have come through COVID?
Well, we were doing, I sound like a sort of a telehealth hipster here. Like, we were doing telehealth before it was cool, like we've been doing it for a few years now. So I think that we were quite well set up to sort of start using that during the pandemic. I think there's probably two things I'd say. One is the technology was there, and I think we were lucky that we had the technology available to make that transition. I think that from a patient side of things and client side of things, during that time, it seems like people probably just from their own personal lives using FaceTime or Zoom meetings or stuff through work just became a lot more comfortable with the modality and just the practicalities of using the technology. I think from the clinician point of view, there was a lot of early anxiety and trepidation about using the telehealth platform, particularly for things like therapy. And I think the feedback I've had from the psychiatrists that I work with and colleagues more generally is that quite quickly people realize that in most situations it is suitable to use, and you get really good results from it as well. And that now there's quite a few patients who are requesting to continue with telehealth beyond the pandemic now that they can return to face-to-face. They're the things that I've noticed.
Thank you, Dave. Actually, Dave, or any other member around the table, if you felt comfortable, what are some of the challenges that have come up with using digital technologies? I know that as a family member of elderly people, that there's been a real, oh, I'm really scared. How do I actually use this? I don't know how to use it. And yet we are aware that the elderly population or older population is certainly getting into the digital services, but we've still got that gap of where some people may not have the digital literacy to be able to gain services. So Are there any ideas of how we can help build upon that innovation that we now know there is this resource that works for many people? How can we help potentially those who haven't been introduced to it to actually take that step? Dave? Oh, sorry, Belinda?
I mean, I'm happy to answer, but did you need to introduce or?
I was about to go to Jason.
I didn't want to take up that space.
No.
Do you want me to say something first and then do it?
Then I'll go straight up to Dure.
Yeah. Okay. So in terms of the telehealth stuff, we've found it's been extremely well taken up, and I think we didn't expect that at all. We expected with eating disorders that it might be problematic for people, particularly the video conferencing, the visual element of it. And we've added, we pivoted all of our services from face-to-face to online during COVID, and we won't be going back because we get a reach to, people across the whole state of Victoria, and also people who want to access a service during their lunch hour at work, or even people who struggle to leave home, some anxiety issues and stuff. It's suddenly made so many of our services super accessible by turning them to online options.
Thank you, Belinda. I'm going to go to you now, Dure. Please forgive it wasn't meant to be an oversight. I was actually trying to be cheeky and save minutes by going to everyone who had started and pull out something a bit further. So if you could give us a bit of background as to who you are and how you got to be here, that would be fabulous. And then I'd like to ask for your insight into innovations from your experience. That's come out.
Thanks, Ingrid. Thank you for the opportunity. So my name's Dure. I'm a program manager at the Centre for Multicultural Youth, and I work in the youth leadership area. I use she, her pronouns, and I'm calling in from the beautiful lands of the Wurundjeri people. So I'd like to pay my respect to elders past and present, and as well as emerging young leaders. I'm actually here on behalf of Carmel Guerra, our CEO, who sent her apologies. She couldn't make it today. And so just to give you bit of background for those who don't know, the Centre for Multicultural Youth is a not-for-profit organisation. It's been working with young people from refugee and migrant backgrounds for over 30 years. We're not a mental health service provider, so we work to support young people, and in particular in my area, we work with young people to be heard, understood and influential in all areas of their lives, and that includes the area of mental health and wellbeing. And more recently, we are being told, and for the decades that I've been in this sector, young people are telling us mental health is a big concern, but I think more and more recently, it is a significant concern and a number one issue across both metropolitan and regional Victoria where we work. The key issue for us is sort of a lack of access to early intervention services and prevention services, and sort of we're seeing more support at critical stages where young people are being at an acute stage of their illness. So we'd like to see a lot more support in early intervention and young people accessing early intervention support services. I also just wanted to say, as a not so young white woman, my intention today is really not to speak on behalf of multicultural young people or their experiences, but I'm really looking forward to sharing our learnings and experiences as an organisation in the partnership work we do with young people.
Thank you. Just to go on from you around what are some of the what's one of innovation that's come through the COVID experience that we can potentially build on and take forward?
Yeah, look, I think for CMY, we've also seen a lot of digital programming, and that has reduced a lot of barriers and increased access for a lot of young people that we work with. But at the same time, it's also cut a lot of young people out. So we have a bit of a balance with the digital access and literacy with young people, is making sure that we've got both, and that young people who don't have that literacy or that access to technology, that is supported. I think in terms of the innovation that we've seen to have the most profound difference is around community-led responses. We have seen throughout the pandemic a real coming together of government, decision makers, organisations and grassroots organisations to make real change. And I think that's the innovation that we're really excited by and can see changing things into the future.
That's great. Actually, just building on from now what we've been talking about around the digital innovation that has come through, there are a couple of comments, and there's one really important one from Neil Turton Lane, who's very much a well-regarded lived experience advocate in the mental health sphere. His concern around hearing that there's a lot more focus towards digital, and that there's a sense that there's a concern to hear face-to-face services aren't planned to return, that feels very exclusionary, which actually builds upon what I was trying to elucidate earlier, was around that there are some people that are feeling like, oh, I don't know how to access it, or I don't get access to a computer, or I don't know how because my literacy is just not there. So that's actually going to potentially bring on some more challenges that I was actually going to ask Dure, and I think you mentioned that you've actually found some ways of being able to manage that. Could you share with us some tips that we might be able to take so that that hybrid model that Belinda's mentioned in the chat, we can actually help strengthen that particular option rather than having people feel like they're being excluded from care and support?
Look, I wouldn't say that we've found the answers. I think for the experience of CMY, we've supported a lot of families, a lot of large households with multiple school-age children, all trying to do homeschooling with parents or carers with, their first language not being English. And whilst trying to educate their children, there's been actually significant challenges in that area. If you've got one computer in the household and 6 kids trying to all homeschool at the same time, I'm sure all the parents out there can totally empathise with that situation. For us, there is some literacy support and work that we can do in terms of increasing people's understanding of technology and how to use it. But at the same time, it's really an access thing. And so that sort of material aid in terms of laptops, tablets, internet connection has actually, it's not necessarily a straightforward solution, I must say.
Thank you. Actually, wouldn't it be wonderful if government and others could come together and provide access to technological devices for free?
Which they did, I must say. In the pandemic, we did a lot of advocacy work with communities, and we saw some really great material aid come from the state government, and were really responsive, and we facilitated those straight to families. There was a lot of challenges getting it through the schools and the education systems for a lot of our families, because there's lots of forms and communication that needs filling in. So I must say the government really did step up, but it did take that advocacy work, and so time. There was a lag. So a lot of young people from refugee and migrant backgrounds did miss out on some of those early homeschool learning.
Thank you. Belinda McGregor, I was hoping to ask your perspective on what's some of the innovations that you've been able to take from the learning of experiencing COVID.
Innovations from, as in my personal innovations from?
General. Both.
Sorry, both. General. So, sorry, repeat the question.
What have been your learnings through working through COVID that's potentially an innovation that we can take on board as a community to help us to cope moving forward, to help with mental health?
So one of the things I've learned, because I was thinking this earlier in terms of what I've learned is that there's been a lot of talk, especially in terms of the community, about the physical health, but not as much on the mental health. So in terms of one thing I think we need to take on board more is more talk in general about, and obviously we're all in the mental health sector right now, but I feel like there's still not enough talk generally in the community. There's a lot of talk about the physical side, and it's very, very obviously that's important, but I feel like there needs to be more talk as well about mental health in general. I just feel like we need to get that more out there. And I think in terms of us all working in mental health, we need to have a really, and it seems really simple, but I think it's very hard sometimes to, it's very easy to forget that we need to also take care of our own mental health. Like, we're all working mental health, especially for me, I work in an acute ward. I'm very fortunate. The ward that I work on, we're very much team orientated, so we really help each other out. We do debriefs if there's been like a difficult situation. So I think, yeah, one of the things I've learned is practically just to really take care of myself, and I've learned it's very different depending on everyone has their own ways. Actually, one of the things we do on our ward is that we give the children what we call safety plans. We get them to talk about what they think and to write down what they think are practical ways they can do to help their own mental health and to help themselves when they're feeling overwhelmed or they're feeling anxious, stressed. And from that, it's got me really thinking about, obviously, my own ways of dealing with mental health. And also, I think practically for people to know where to, like, especially say it's a workplace situation or even in a societal situation, who to call, what are the mental health lines or whatever. Like, for example, with nurses, like, you know, with most, like I say, most jobs, it's like, you know, EAP, employee assistance program, or for nursing, there's a specific nursing number you can call just to have a chat with someone. So that's the practical thing I've learned is to try and take care of myself, obviously my own mental health, and also to encourage others to really look at their own mental health so that they're then in a position to help others.
Thank you, Belinda. Actually, you've been your response is a nice segue into the next question. I might like to ask some of the other panelists, and it's actually popped up on thementi.com as well, around workplace, around how we can help each other in our particular workplaces to deal with our distress or our stress levels, and what can we do to support each other during what's been a really harrowing time. And we are now changing how we work. We're working more, or those of us who are blessed to be working, finding ourselves often in roles where we're overwhelmed. And so how can workplaces help us and help support and create an environment that's safe for people to work in? I might ask you, Dave.
I suppose from my experiences from a workforce perspective within our practice, the discussions we've had as amongst our group and amongst the myself and the rest of my colleagues, is mainly around I think prioritizing having time away from work as well, and that's been sort of increasingly difficult to do when there's been a bit of an intrusion into the home space of work. That you know, the fact that we're able to luckily keep working and be able to work from home, I think comes with its challenges as well, that then your home space becomes a workspace. So it's the same for clients as well, that we're seeing people in their homes. It's a bit of a transgression into that sort of home space, I think. But I think that being aware of that and having the ability to remove oneself from work, but also from taking time off work. I know that most of our experience has been people not taking any leave or not taking time off during this period. So I think having a bit of prioritizing that and still the need to find time for family and for themselves away from work.
Thank you, Dave. Belinda Caldwell, what has been your experience in your workplace or from people that you've spoken to around workplace issues in COVID times?
Yeah, look, I mean, certainly, you know, I think particularly that beginning part in 2020 when it was terribly abrupt, it was like we were in an office and then within 3 days we were all, you know, flung out into our homes. And from EDV's perspective, we had to, you know, change, you know, our helpline call takers were all doing it from their homes, and so a lot of the service delivery that we were doing, the people providing those services were doing them from their homes, which I think we rapidly realised we had to be conscious of, because, you know, it's less safe in a way than if you're all in a room together and you can debrief really informally with people. So it was really about creating space for people to debrief, pick up a phone. All of my team, we had things like Teams, Microsoft Office Teams set up, and everybody adopted that really quickly, and it just rapidly became a real chatting space that replaced some of that informal chatter in the office. We sort of grappled at various points with things, but we certainly added the opportunity for staff to take a mental health day in advance. Up until that point, the mental health days had been something that if you hit a wall on a particular day, it was okay to take, it was encouraged to take, but people were saying that wasn't helpful because if they had a lot of things on that day, they were going to have to pick them up the next day, that actually booking that in advance was more helpful for people. So we introduced that. I think the other thing that I think has been really good is just to make sure that there's a lot of humour around. And I think in some ways that's sometimes understated, that there's just, lots of, we've had online social events, we had an adventure trivia thing recently, and it just sounds twee and all of that kind of stuff. And, people will go, do you really need to do it? And yet, as soon as we'd done it, everybody just went, that was such a good thing to do. It was just fun to laugh and not be talking about work and not having a meeting about work. And so just that real, the opportunity to just have fun. And, everybody's gotten completely obsessed with GIFs on Teams, that there's a gift for everything, but it's just those sorts of things. Yeah, so it's a whole mix of things, the supervision, letting people call it when they need some mental health time out, and, checking in regularly with people, particularly the volunteers, taking the phone calls and things like that.
Thank you, Belinda. Actually, that's a really interesting and it's often forgotten part of our humanness is to laugh, the importance of laughing, the importance of being silly. I know that many of my colleagues around the Zoom world, we had, well, what are you wearing down the other half? Slippers that pop up. Some of us would actually confess that we only had earrings that changed every day, didn't matter what below. So it's that fun element. And because we now are doing more meetings at home and having more an online presence, it is a different way of communicating. And in fact, we are, as Dave so articulates so well, was we do, and we are now seeing people in their homes or in their personal spaces. So what I found as an adjunct to that was that many of the meetings that I was having, colleagues would be more willing to ask, well, how are you going really? And then we'd start off a meeting having a chance to debrief or doing a blah and having a chance to share so that we were all sharing vulnerability at the beginning of a meeting. And then we would find that they actually created that sense of safety, even though people weren't forced to share what they weren't comfortable in sharing, but having a sense of, well, let's create a more relaxing environment together in a more obvious way so that we can have and be more productive, which inevitably was the outcome. And I think that's the other message, is that sense of some of us have been too productive and working too hard, and again having to need to put in that self-care. Now, I'm really aware of time, and I'm also conscious that I'd like to this time get some questions in from the audience members. So one of the popular questions has been around, how has COVID affected the rollout of the Royal Commission's findings and reforms? Do we need to revise our timeline? Now, I might open this up to all of you and ask who might like to respond to that question.
That's a tough one. I'm happy to go. I know I only just spoke, but
that'd be great, Belinda.
It's probably, it's a key part of my job to be across all of this. I think we've just got a real challenge. We've got a real challenge that we have to move the Royal Commission reforms forward at the same time as dealing with this thing that has emerged since we sort of were coming up with the Royal Commission recommendations. So we've got two things happening at the same time, and I don't think the demand is going to go away anytime soon. And so I think it's that juggle for the next few years, which is going to be tricky. We're going to have to juggle managing demand currently while we're trying to build a new system at the same time. So I'm only really talking about the challenge, really not any solution. But I do think it's a really critical challenge that we can't drop the demand that we have right now while we're building, this shiny new thing.
I like the way you've said that, Belinda. One of my colleagues recently said, we're flying the plane while we're building it.
Exactly.
And it's that acknowledging, actually, we've had a hiccup in what we were doing. We've had COVID come along and really pull the rug from everybody's feet. So how do we adjust, or do we just float on the magic carpet and just drive it as best as we can with everything that we've got on our plates?
And I think, sorry, I let the other ones talk, but I think what has helped has been some of the amazing innovation that's happened over COVID. I think, the mix of additional funding, demand, needing to come up with rapid responses has generated so much innovation that I think there's a whole lot of learnings from that are directly relevant to the Royal Commission, and making some adjustments to that.
Thank you, Belinda.
Sorry.
Belinda McGregor, please.
Yeah, can I just say as well, I find it interesting. This is kind of bringing everything that we've been talking about today. And I think especially from the point of view of working in an acute ward and having obviously more and more patients coming and more acute patients come in, and a lot of the recommendations around community and building up that real community support, which we really, really need in terms of mental health. But at the same time, you're all talking about, like, hopefully we won't need another lockdown, but this idea of lockdowns and that community, like people in the community needing mental health, and then maybe not being able to get that face-to-face, as we were talking earlier about having to go on, do the video calls, and then, we were talking about how that itself is its own issue. And obviously, again, I'm not coming up with a solution myself, but I just thought that was interesting how, it's all kind of like come together, what we've been talking about.
I think at the moment we've all been so reacting that solutions have been coming along as we fly the plane again, and that we're going to have to be adaptable and flexible with what is it that we're going to be able to do, because there are no quick, easy answers. There's no one silver bullet that's going to come along and help us to find all the answers to all these complex issues. But at least if we can start addressing them and acknowledging them, then we've got a better chance of actually working with the changes that we're going to be facing, as opposed to potentially ignoring it. What I would like to ask is, because I'm cognizant that we're about to finish, I don't want to leave Dure or Dave without having a last word around just sharing. Is there a message that you would like to leave our audience members with around COVID mental health, and how we can actually get through what is still an unknown period?
Sure, I'll jump in. Sorry, I don't know. Someone else was going to jump in then. But look, I think for us and working with young people from multicultural backgrounds, there's often a lot of talk about young people. There's often a lot of talk about culturally diverse communities. We want to see more conversations around the intersection of those two identities, as well as in recognition of young people being seen for the multiple identities that they hold, whether that's LGBTQI, living with disabilities. There's many, and I think that sort of flipping the language on that we talk about young people facing barriers, and we want to see the language flipping that it's actually society placing barriers on young people from refugee and migrant backgrounds in accessing appropriate mental health services. And if we can flip that language, we can start seeing it as our collective responsibility. And for us at CMY, we've seen, as I mentioned in the beginning, some real innovation in how we work with communities and community-led responses, but also a recognition that we're incredibly agile and adaptable as humans, as an organisation, but as a society as well. We've made widespread change over the last couple of years, and we can continue to do that, especially in the area of mental health. And for us at CMY, it's definitely around how we engage diverse communities in the services. We're seeing like 10% of young people accessing from refugee and migrant background accessing Headspace before the pandemic, despite being 46% of the population. And now we want to see that change. We need to see that. And I think we can do it. And we know we can do it because we've had widespread systemic change.
Thank you. Dave, you've got the final word.
Thanks, Ingrid. I think the thing I would say is that there's been a lot of talk about this COVID thing as being unprecedented, but the thing is that there is a precedent for there being, you know, multiple crises and situations that are going to put an increased load on the mental health system. We're talking, you know, the previous discussion about bushfires. There's going to be further crises, and I think that the best thing is for us to do is to try and build in additional capacity in the system rather than trying to react in the middle of a crisis. I think that we need to be at a position where we have additional space to absorb that rather than having to scramble madly when the next crisis comes along.
Thank you, Dave, and thank you to all of you for participating in what's been an amazing conversation, and one that I'm sure will keep on going. And I'm hoping that there are some little messages that we can take away to actually help us in our reflection and in our working and family lives as we continue on facing the end of 2021 and coming across 2022. So thank you very much. What I might like to do in the last few moments is to wrap up our two incredibly powerful presentations, panelists of so much experience and knowledge, and their willingness and generosity of spirit to share. There's some interesting, hopefully, take-home messages that I'd like you to share in our Mentimeter that you have actually been able to pick up from today. Now, as you're writing those particular words in, I wanted to share just a couple of my own reflections of today's session, and also hopefully trying to roll in some of the overarching different messages that Mental Health Victoria has tried to actually do throughout its webinar series, some of which you may have participated in, others you may not have. But the thread has been around connection, and never more so than now. It's something that we've got to keep out there. Keeping out, reaching in and leaning into one another is so important for our mental health and well-being, no matter what the situation is and no matter what population group we might be in. And it's all of lifespan. We can be there to help teach each other's children and our young ones to keep communicating in whatever way we can. The human touch, music, doing arts. There are so many ways of communicating, and we need to find what works for us, and what works for one person may not work for somebody else. And I'm seeing all these wonderful words that are popping up that people have gained from this session that hopefully they can take away and use tomorrow and the days to come, months to come, years to come, as we manage and navigate life's challenges, whether they be disasters, whether they be COVID, or all the other things that life throws at each and every one of us. One of the key messages that I've had from all these sessions, and particularly today, and I'm going to steal from our real estate agents. They often talk about location, location, location. One of the things that I'd like us to consider is around education, education, education. That's really important because it's empowering to be educated. It feels confident. When we're confident, we have more opportunity to share because we feel more confident and comfortable with sharing what we know. We don't know what we don't know. So the more we can learn, the more we can actually hopefully use as an opportunity to connect with other people. And it may not be through formal channels of education. It might be through each other that we can teach each other the most important and valuable lessons, which is what Rob alluded to, that unfortunately, sometimes we learn our most powerful lessons through experience and through traumatic experiences. But that's not to say that life doesn't bring us all sorts of opportunities to learn. So the next element that's coming through here is communication, communication, communication. We've got hope, we've got sharing, there's empathy that's popping up, there's support that's popping up. And that all funnels into the last one that to me comes out of this is connectedness, connectedness, connectedness. And so bringing all of those together, and what comes first? There is no continuum. There is no one starting point. It's going to be different for all of us. But if we can go in and remember that we can reach in if we don't want to ask for help, and it's really hard to ask for help, perhaps we ask somebody, or someone can come to us and ask us, because it's not always that easy to be able to say courageously, or even with a voice shaking, look, I need some support, I need some help. But those of us who are able to ask, it is great if we can ask and can feel safe within each other's family situations, or within each other's community or education facilities and programs, or through sport. So I'd like to say thank you so very, very much. We've got 3 minutes before we finish. I'm watching this word cloud, and I have to say I'm really partial to these because I love seeing what pops up in them. And there's that connectedness that I'm seeing here, that we share so many of these messages: being caring, sharing, generous. The generous spirit of humans can never be underestimated. So I'm going to end on that note to actually invite others to come back afterwards for the AGM that reconvenes at 2 o'clock, and to say thank you to every one of you for participating in this webinar and for supporting Mental Health Victoria with other webinars that we've had during the year. And we look forward to seeing you again in 2022 for more events. Please stay tuned for the responses to our questions in our next newsletter, and please keep the channels of communication with Mental Health Victoria open, and we're here to help provide you with support. Thank you, and have a restful 2021 ending, and look forward to seeing you in 2022.